No doubt Medicare is becoming a thing in Idaho, benefits and coverage. You can get your policy once you are a legal resident of the U.S. for 5 consecutive years or more than that and ages 65 years old and over. However, there is still a chance that you can get Medicare coverage if you are 65 years old and receiving Social Security or Railroad Retirement Board disability payments for 24 straight months. Diagnosed from end-stage renal disease, ESRD. Have amyotrophic lateral sclerosis, ALS. But before you enroll on your policy, make sure you understand the enrollment period for Medicare here in Idaho. When is the right time to enroll in a policy when you can drop or change a new coverage? Here's a perfect article for you to identify when to start your Medicare shopping. When can you join Medicare Idaho plans? For people who are new to Medicare, there are specific dates on when you can sign up for Medicare plans or make changes to your current policy. A. Initial Enrollment Period, IEP. An initial enrollment period is a time you're first eligible for Medicare. This event will happen 3 months before you turn 65 years old and 3 months after your birthday. It is a 7 months enrollment window, however, there is a delay in your coverage. B. General Enrollment. General enrollment runs from January 1st to March 31st. This time you can sign up for Original Medicare, Part A and B, or Part D, prescription drug. The general enrollment period is a perfect time if you missed your IEP and you're not eligible for the special enrollment period. But, you may face a late sign-up penalty for Part B and Part D if you missed your IEP. See Open Enrollment. An open enrollment period is where you can change your plan options during this time. An annual enrollment period happens from October 15th to December 7th. D. Medicare Advantage Open Enrollment. If you are already enrolled and planning to switch your original Medicare to Medicare Advantage plans or switch back to original Medicare, you can do not on January 1st to March 31st. E. Special Enrollment Period, SEP. A special enrollment period is granted when you lost your coverage or missed out on the enrollment period for a qualifying reason, such as moving out of the plan's network area, terminating your current plan, losing an employer-sponsored plan. This time you don't need to wait for the annual enrollment period to get a policy, you just have to pass the certain requirements to get qualified for September. Now that you know the particular dates of your Medicare enrollment, make sure to never miss out on your IEP to avoid penalties on your Part B and Part D. Aside from this, we're giving you tips before enrolling in Medicare. Idaho Medicare Annual Enrollment is happening right now. Whether you're new at applying for coverage or planning to switch a new coverage, make sure to consider everything you need before going on your choices. Getting your Medicare coverage is never easy and sometimes confusing. The only thing you can do that will provide you better choices and options is to seek help from a skilled agent/broker to assist you out through the entire process.